Welcome to another Renewal podcast here at a hidden BTS SkyTrain station here in Bangkok. Today I am here with Amanda and Baum. Is that right?
Yep.
Amanda and Baum.
Sorry, Amanda and Baum. Haven't seen you guys in a while. We're going to be discussing concerns related to scarring after surgery, which is primarily plastic surgery, but not entirely, right? Okay, so if you have questions, you can email us at info@renewal.com or go to renewal.com or visit us on Facebook at Renewal or YouTube at Renewal or Twitter, and we'll get to that later. But Amanda, why don't you lead off?
So actually, just before we left the office to come here and film this podcast, I had a client. She had facial surgery, and her follow-up appointment just under a week after surgery was today, and I was checking in with her to see how everything was going, making sure she was healing okay. And she and the surgeon are both like happy with her healing process, but she did say, "Oh, but I'm really scared about these scars. Is it still going to look like this?" She's like 4 or 5 days out of surgery, and there's actually still the stitches in there. And so I understand her panic because everybody says the same thing. You know, a few days after surgery, yeah, they're very, very intimidating, the scars. And so I have to tell people like don't freak out. It's going to get better. They need some time to heal. They need to take out the stitches. And there are more people than you think who have had plastic surgery, and you cannot see those scars. So follow the surgeon's instructions in terms of keeping them clean, dry, and healthy. And then after that, use your sunscreen every day, use your scar gel, cream, or oil every day, and then give yourself, a couple weeks, a couple months for it to smooth out and then to fade lighter.
That sounds fair.
Yeah, just don't panic, because I know they look bad, but it'll get better. Don't be scared. Yeah.
And Baum?
Yeah, the most concern is like the eye and facial thing. That like as you said, that like people will be more panic when they have like it's about appearance and stuff like that. That like some people ask me like why after like 1 or 2 days after the surgery, like why my eye so big? Like it's still like some dark stitches that's still on your eyelids, so it's you take it like some time, give it some time to heal and stuff like that, and you might. After you remove the stitches, you might wonder like why it's still not going down, but it takes time for that and it will go down.
And a lot of the scarring on the face can be hidden. Like some surgeons will do it around the ear area. But things to consider if you're doing your brows, then it's going to be, the scar while it's healing is going to be quite prominent. And if you have really short hair like I do, and for some reason if you need something to do with like the neck area, occasionally there can be a scar around here. And if you don't have long hair, it's harder to hide.
And the more sun damage you have and things like that, you're going to have more scarring to pull the...
Yeah, and I've had a lot of male clients actually get facelifts, and they tend to have a lot more sun damage and a bit thicker skin, so those scars are more visible. And so in those cases, you might have to accept that there'll be visible scarring. But for the majority of cases, after a certain amount of time, and if you take care of it and stay out of the sun and use a fading cream, they won't be noticeable.
So if you look like me... bad.
Yeah, we wouldn't recommend a facelift.
Okay, no hair to hide it, sun damaged skin.
Yep.
Right, okay, right. I'm a bad candidate.
I just have the client who actually have like full facelift recently. So the doctor actually tell him what to expect and where the scar will be, so he understand that and he not panic. And he said that like he quite really happy and very pleased with the doctor recommendation and then the result. Everyone is just only like 2 weeks after surgery now.
Yeah.
So it depends on your expectation and your understanding as well for scar.
Actually, I'll toss one in there.
Yeah.
Couple things that happen after surgery. We work with good surgeons, and if you're going to get a facelift, for example, you're going to go to a surgeon who has done a lot of facelifts.
Yep.
Yeah.
We're not just tossing you to the email department at the hospital and going, I wonder who's on the list. So when you get recommendations about removal of sutures and things like this, and then you go online in those days when you're sitting in the hotel and you got nothing to do, and this former patient says 4 days, and this one says 7, and this one says 10. That's fine to bring up, and we're totally happy to answer that, but you need to follow your surgeon's guidelines, basically.
Because that make you panicking, like when you sit at the hotel and nothing to do, and all you thinking about like your scar, and just Google like, oh, this supposed to be like this, because you have to understand that like each person, the healing process is different.
And because you're at the hotel, that means you're still here, which means your surgeon is nearby. So instead of asking Google all those questions, ask your surgeon, because you'll have follow-up appointments, and if for some reason you want more, you can have more follow-up appointments. You can see the surgeon as much as you want. You can talk to us as much as you want. So save those questions for the surgeon instead of Google, and then you might feel less panicked. Yeah.
I think that's fair. There's never been a case where they couldn't see someone, even if your surgeon happens to be out of town or extremely busy. You'll be able to see a doctor, surgeon, or nurse who can advise you on this topic.
Oh yeah, and then I think body scars too. So people aren't quite as worried about them because you can hide them with clothes. But the larger scars, like thigh surgery and abdominal surgery, you need to take care of those because they're so big. Make sure that they stay clean and healthy. And then later on, I've had a lot of clients get tattoos to cover them up, which is okay. You just have to wait until they're totally healed. So maybe give yourself like a year if you want to get a tattoo on the thigh or the stomach to cover up a scar.
And don't. I should also say don't. It's a weird balance. Bring up anything. We're always happy to answer anything. Don't feel like you shouldn't bring up anything, because there have been cases where someone has said, should I be worried about this? Yeah. And we've looked and said yes. Not like freaked out, but let's get you to the hospital now. And things have been fixed in Thailand because they brought it up. So definitely bring it up, and we will take it seriously. But also keep in mind, the advice may be, actually, I know that feels really weird, but you're on course for a good recovery. Yeah,
just ask us if anything comes up. We'll double check with your surgeon.
Yeah, I think so.
And I also have the client who have a tummy tuck and also thigh lift. We check in with her pretty much every month and to update about the scar, because she really concerned about her scar, if it's gonna get thing bigger or it's gonna get a keloid or anything. But luckily it's no keloid on her scar. So but the doctor recommend her what she should do with her scar, because it's kind of long scar for thigh lift and also tummy tucks. So we be in touch with her, and we coordinate between the client and also the surgeon to get recommendations.
So keloid is a good point, because when you fill out your medical evaluation, so there'll be questions about scarring, usually about keloids, and if you're not sure, you probably are not someone that gets keloid scars. If you've ever had a scrape, a cut, a tattoo, or a piercing, you would see them get rise in texture, they're very noticeable. So I know everyone's concerned, everyone gets a scar, but keloid is different. That's a lot bigger. So you'll know ahead of time if you are someone that gets keloid scars, and in which case tell us up front, because then we need to figure out the best way to handle your surgery.
Yeah, and also if there's any issues with scarring afterward, which really, honestly, we haven't had. There've been there's very few things. They just fade over time, but they can. In any case, let's say you're at home and you cut yourself. Same issue. You've got a scar. Please don't cut yourself. You can go to the dermatologist and they can use lasers and other things to do ablation over time. So there are treatments if you have scar concerns, but the vast majority of scar concerns take care of themselves.
Honestly, usually by the year check-in, because we still check in with you a year afterwards, the scars have faded so much by then, people forgot that they were panicking over it. Because you know what, those first 3 months, think about how long it takes your skin to heal. We've all fallen and just even scraped your knee. That takes, it'll be a month or two before something that superficial heals. So just give your body some time, treat it well.
Yeah, the scars are so minimal that they don't even answer the 1 year check-in.
Yeah, that does happen in the 1 year check-in. They're like, I'm fine. Why are you still talking to me?
Who are you? Oh, Jesus. Okay.
Yeah.
Got you.
Don't forget about us. And you don't have to forget about us, because you can find us online. Yeah. On Instagram, on YouTube, on Facebook, on Twitter, on the web at just at renewable.com. None of that www stuff, that's excessive. And where else? AOL. Where else are we?
YouTube. The BTS station.
Email at the BTS station. That's right. You might find us wandering around town.
Maybe we see you at the hospital sometime.
That's true. You can find us
call call
all the finest hospitals. Yeah. Yes. All right. So thank you very much.
Thank you.
Thanks.
Bye-bye.